Hi, my name is Anna. I am a travel ICU nurse, and this is how to get a job in the ICU as a new grad. So you're admitted into an ADN or a BSN program, you know that you want to work in critical care. It's important that you clarify your goals within the first or second semester of nursing school, and the best way to do that is by being a CNA or an EMT before you start nursing school. And if you don't have the financial means to do the CNA certification before starting nursing school, many states have nurse externship programs that you can work as a CNA while in your nursing program after you finish med-surg too. So I recommend that everyone work as a CNA while you're in nursing school to supplement your clinical experience. The program that I did, I was a CNA before I started nursing school. I worked in a nursing home for 6 months, and then I started in a burn ICU as a CNA, and they trained me to be a surgical burn technician. So as a surgical burn technician at a level 1 trauma for a year. And then in the process of nursing school, I did some shadowing and I discovered that I really enjoyed cardiac surgery. So the last year of nursing school, I did a nurse externship in the cardiothoracic surgical ICU. And with that program, as a nurse extern, I was able to do lab draws, to place IVs, to place Foleys, and to do blood cultures, all of which were things that I didn't even get to do during nursing school. And the nurse externship experience allowed me to network, to get a preceptorship in the ICU at a different hospital because one of my coworkers was willing to take me on to a different ICU. All of my nurse extern and CNA experience is what got me the job as a new grad in the ICU. I started in a top 3 CVICU as a new grad, and the transition was difficult. The learning curve was still very steep, but because I had had 2.5 years of hands-on clinical experience working with patients, de-escalating situations, running codes, working through emergent situations, hands-on procedures, I was able to acclimate to working in the ICU much faster. And the critical care world is a small world. I recommend making friends wherever you go and keeping a very learning and inquisitive spirit. So the best way to get a ICU job as a new grad is to be a CNA in the ICU before you start. Additionally, I would recommend only working 1 day a week in the ICU as your contract. So try to find a flex position or PRN position where you only are obligated to work 1 day a week in like the cardiothoracic ICU. And then if you're working more shifts than that a week, pick up on other ICUs to figure out what your speed is. So I would work 1 shift in the CT ICU, I would work 1 shift as a phlebotomist on the floor, and I would work 1 shift on the MICU, on the surgical trauma ICU, or in the ER. So you can call those units specifically to pick up on other ICUs so you don't have to float through the general hospital. You don't have to go into the staffing numbers. And also keep track of all of your clinical hours as a nurse extern and as a CNA. So when you're going through and writing your resume as you're applying to new grad jobs, you can say, I have 400 hours of CT ICU experience. I have 80 hours of MICU experience, 120 hours of ER experience, 100 hours of phlebotomy experience. You can go through and you can itemize your critical care experience, and that's gonna present that you have a much more robust critical care application than someone who only maybe had a clinical rotation during school. I can't recommend it enough. It's the best way to do it.